Good evening, everyone, and welcome to our show, Doctor of Life. Today, we want to talk about the impotence problems and premature ejaculation. We will talk with our Dr. AlaaAbdAlazizAglan, manager of International Center of Cosmetic Surgeries and Penis. Welcome, doctor. First, if you can tell us, doctor, what is the premature ejaculation, its reasons, and what are the latest technologies to treat it?
Premature ejaculation has so many definitions. The ejaculation takes less than 1, 2, or 3 minutes, but I consider the practical definition is the ejaculation before the other part reaches the orgasm. 40% of men, however, suffer from the premature ejaculation. The European and American associations used to admit that there is no surgical solution for the premature ejaculation. However, there were attempts to cut or burn the nerve, but after 9 months of the surgery, the patient will have to do the operation one more time, as the nerve will grow back again. Plus, it is very expensive operation. It costs about $3,500. That's the first problem. The second problem with this operation is some of the patients don't respond to this operation though. I developed a new operation for the premature ejaculation. However, we use it whenever there is no use for medication treatment. Premature ejaculation needs to happen more than once for a long time to declare that a person is having a premature ejaculation. Some psychiatrists advise with pills. However, some cases don't respond to them and the side effects start to show up, of course. We developed an operation with two major sides. The first one is the bomber muscle or the bulbous pangiosis muscle that is actually affects directly on the ejaculation process. When we removed it, the ejaculation period has been improved significantly. However, the second part, other patients complain from the penis's sensitivity. We found out that they have a very sensitive skin. As well, there is an area called frontalar delta. It is actually beneath the head of the penis, and it is the most sensitive area of the penis. That's the reason why whenever these patients use the spray on the head of the penis, there is no effect whatsoever. However, the frontalar delta is actually like the G spot at women. When we remove it with spinal anesthesia, it works very fine with these patients. And if the patient doesn't want to do any kind of surgeries, we advise him to use a spray on that area only. If we did the two operations together, the success rate will reach up to 97%. On the other side, the 3% of patients has an issue of brain controlling over the sexual process, and they don't respond to the medication mostly. If the brain is the only part that controlling the sexual process, then the premature ejaculation will happen for sure. At the sexual dreams condition, the dream will only take about 6 seconds only, no matter what. However, the ejaculation process is going to take about 0.48 seconds. That's almost half a second at this dream. So the premature ejaculation will happen whatsoever. However, when we use the medication pills and the operations together at the same time, the issue is going to be resolved properly with great results.
Are there any preventives of the operation, doctor?
Not at all. On the contract, even on the impotence cases, we do these two operations to make sure everything is okay and satisfied to the patient.
In the cases of impotence, what is the implant and what does it do?
It is a like silicone pin installed inside the pin. However, the implant shortened the penis whatsoever from 2.5 to 4 centimeter though. So we do an operation to enlarge the penis to make sure that the penis remains its long or even add an extra length as well. Also, we add extra treated fats inside the penis to increase the thickness of the penis.
So, doctor, do you use partial anesthesia or full anesthesia? And will the patient can practice sex again?
We use both ways, but I prefer the spinal anesthesia as it is safer to the patient without any kind of pain. The premature ejaculation operation takes about 8 to 10 minutes, and the patient can leave the hospital at the same day and practice sex after 3 weeks. But of course, he cannot carry any heavy weights within the first 5 days. The implant operation, though, takes about 20 minutes. The patient can leave the hospital after 6 hours but cannot practice any kind of sex before 40 days or 6 weeks.
Is there any specific age to do the operation?
Not at all. We do the operation to all kind of people from 90 to 17 years old people.
Will the patient need to change the implant again after a while though?
No need to change it or remove it without any reason to that. It lasts actually for a lifetime though.
If a patient suffers from a small penis, is there any solution for that problem?
Under 15 years old, the hormone treatment is going to be very helpful. But otherwise, we will need to enlarge the penis and increase the thickness. And sometimes we use pedal expanders after the surgery.
Thank you very much for giving hope to the people, doctor. I really appreciate it. And thank you very much for being with us today. Goodbye.